Hello and welcome to another episode of Health Digest, a program that brings you news, analysis, development, and everything that concerns your well-being. I'm Ogom Ezedimbo.
On Health News today, the Nigerian government has reaffirmed its commitment to eradicating tuberculosis as the country prepares to commemorate World TB Day on March 24th. The Director of Public Health at the Federal Ministry of Health, Dr. Godwin Ntadom, and other key players in the health sector during a pre-World TB Day news conference in Abuja on Tuesday highlighted the nation's progress, ongoing challenges, and renewed strategies to combat the disease. Dr. Godwin Ntadom particularly emphasized that tuberculosis has driven many families into poverty and untold effects on the economy.
Leveraging digital health solutions, the use of digital tools, mobile technology, and artificial intelligence is being expanded to enhance surveillance, case management, and adherence to TB treatment.
With the unwavering commitment of healthcare professionals, policymakers, and advocates, alongside innovations such as a shorter treatment regimen and digital adherence technologies, we are closer than ever to eliminating TB. As we all know, in the light of the dwindling donor support, we need to intensify our advocacy.
The Chairman, House Committee on HIV and AIDS, Tuberculosis and Malaria, Amobi Godwin Oga, said the committee was doing everything possible to ensure that tuberculosis gets its right budgetary allocation to stop the spread.
We moved a motion in the House of Representatives calling on federal government to increase domestic funding for the response to TB by establishing a private sector-driven trust fund for TB, just as we have for HIV and malaria. The Committee on ATM will ensure transparency and accountability in the disbursement of these funds to ensure that funds meant for the interventions programs are judiciously spent and not mismanaged or diverted.
Tuberculosis remains a major public health concern in Nigeria, with the country ranking first in Africa and sixth globally among the 30 high TB burden nations. The Nigerian government says strengthening local government financial autonomy is key to improving primary healthcare services and achieving universal health coverage. The Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, stated these at the National Stakeholders Engagement on Accelerating Improvement in Nigeria, Abuja. Professor Pate emphasized that an effective implementation of local government autonomy will foster a unified national health system that prioritizes the need of all citizens. He noted that President Bola Tinubu's administration remains committed to health sector reforms that ensure quality, accessible, and affordable healthcare services at the grassroots level.
The approach itself fundamentally includes the idea of a collaboration across multiple levels. Collaboration because federal government, state, and local government have to join hands to make it work. We don't have 774 health systems. We have one coherent national health system. It is also a collaboration across sectors. So it's an approach, but that is contextualized to communities, resourcing, needs, but everyone rows in the same direction.
The Executive Director, National Primary Healthcare Development Agency, Dr. Muyi Aina, underscored the importance of financial independence for local governments in improving healthcare delivery. He says collaboration among all levels of government is necessary to drive sustainable reforms in health sector.
And together we are evolving a healthcare system that is centered around people and delivers affordable quality at little or no cost to people. At least we want to remove cost as a barrier for the most basic services. There's no system that can provide everything for free. But I think within our context, the resources that we have, which is now more, thankfully now that we have the local governments in the room, our resource port has expanded.
The 774 local government council chairmen in Nigeria are ready to collaborate with all relevant stakeholders to showcase their leadership potentials and capabilities in the implementation of their constitutional mandate towards better governance at the grassroots level across the country.
The event brought together stakeholders from across the health sector to discuss strategies for strengthening primary healthcare services through effective resource allocation and improved governance at the local government level. That's it on Health News. I am Chidera Izudoi.
Lassa fever cases in Nigeria are on the rise. Additionally, the country is recording cases of meningitis and diphtheria, raising concerns about the nation's preparedness to tackle infectious diseases. In response to these outbreaks, renowned virologist Professor Oyewale Tomori is advocating for the decentralization of the Nigerian Center for Disease Control and Prevention and to enable state-level responses that are swift and more effective. Health Digest caught up with him at an event where he shared his insight.
It's an embarrassment, even worse than that. It's a painful thing. It shouldn't be happening. We've talked about Lassa fever now for the last 50 or more years, and we're still where we are. Year in, year out, it's like it's a new disease. We shouldn't be. We should be better prepared for what is happening. If you check the records from NCDC record, it's like every year we have a higher number of cases being reported, and many more cases being confirmed. But what is worse is that we only set up those committees after many people have died. We know this starts around October, November. Why are we not getting ready for it all the time? It's very painful to see what we're doing with Lassa fever in Nigeria.
We see that the outcomes for fighting Lassa fever, especially when there's an outbreak, is kind of slow. Would you recommend that the NCDC be decentralized?
For me, I've always said it. We keep talking about political restructuring. I think NCDC also should be restructured. In those days, the states and the local government were taking care of all their problems. Nowadays, everybody is waiting for NCDC to solve the problem. The cases are occurring in my mother's village where the NCDC is not known. The local government, the state people, and the NCDC. NCDC should be there coordinating the activities of what is going on. The states and local government should be the ones that are there. That's where the diseases first occur, and those are the first point of contact. They should be equipped to do this work rather than wait for NCDC to come in to 2-3 weeks after something has occurred before they come in and bring people. We should equip our people at a different level to carry out and monitor their own problems. And NCDC can come in to coordinate. I think strictly we should decentralize the NCDC. Let each state have its own CDC, even at the local government level. And we bring the problem is right there, and we let them take each action. NCDC can come later on as a coordinating body, not a controlling body.
Do you think the states, governments are ready to equip their various states for response mechanism?
Well, you see, it is not whether they are ready. They must be ready. We were doing it before. In those days, I knew about state EP divisions, local government EP divisions. What happened to us? Well, we all coming to Abuja for the solution. Each state, each local government. I remember in those early days in the 80s, we used to have annual meetings of state EP divisions. Each state bringing their own problem, and federal at the top coordinating. We should go back to that one. And don't forget, it is not that we don't have the resources. I believe when people say Nigeria is resource limited, we are not. We're resource wasteful and we're resource quandary. If we spend our money well, we put the right thing in place. Let me give you a good example. A governor leaves from his office to his house, and there are 20 cars in his entourage. And a P division in a state government doesn't even have a bicycle to go and investigate an epidemic that is going on there. What are you doing with all those 20 cars that are following the governors when one of those cars can solve that problem at each local government point? These are the things we should be talking about. These are the resource wasting things we should get. We should change our orientation. We should reprioritize, get our priorities right, and put the money where our problem is.
If you're just joining us, this is Health Digest, your go-to program for all things health. And today, we turn our attention to glaucoma, a leading cause of irreversible blindness worldwide. Experts describe it as the silent thief of sight because it progresses gradually and often goes unnoticed until significant vision loss occurs. Our guest today is Dr. Obiageli Oketa. She is the co-chair, Public Health Committee of the Nigerian Optometrists Association. Thank you so much for joining us on the program.
Thank you for having me.
Glaucoma, called silent thief of sight. Give us more about it.
Okay, glaucoma, I would like to define it by saying that it's a group of eye diseases that damage the optic nerves behind the eyes. Now, the optic nerve is the part of the eye that carries the information the eye perceives to the brain for interpretation. So if anything goes wrong with the optic nerves, then vision would be lost. And this vision loss is usually irreversible. So in cases of glaucoma, when the pressure of the eyes go up for a prolonged period of time, the optic nerves become damaged, and usually it goes unnoticed until significant vision loss occurs.
So you mean I'll just be working with glaucoma and I won't know?
Most times, yes. You know, there are some people who come into the clinic, they just come in for, I've had a patient who came in with itchy eyes. In fact, he called me over the phone and asked me to recommend something for his itchy eyes, and I encouraged him to come over to the clinic. And when he came, by the time I looked at the back of his eyes, I saw that his vision was already going. And he didn't notice it because glaucoma usually begins to attack the peripheral vision. So it goes unnoticed. And thankfully, just about 60% of his vision was gone, and we've been able to manage the remaining 40%. So yes, it's possible that someone has glaucoma and they are not usually aware of it.
Are there different types of glaucoma, and do they affect people differently?
Okay, yes, there are different types of glaucoma. The commonest type is the open angle glaucoma. And then we have the normal tension glaucoma, we have the secondary glaucoma, the congenital glaucoma as well. And also, there are times some people take steroids for a long period of time, oral steroids or the one they drop on their eyes, that also predisposes them to glaucoma. So glaucoma mostly affects people who are 40 years and above, although some babies are born with glaucoma, and that is the congenital type of glaucoma. If it's detected early and managed early, the child's sight can be preserved. But there are some people, especially in the rural communities, where they're ignorant, you know, they wouldn't notice that their child has glaucoma. And then if that child's vision goes, there's nothing that can be done about it.
What would even make a baby to come to this world with that kind of eye problem?
There are different causes. Maybe the mother was on some kind of medications when she was pregnant or something, or the mother had a particular, disease. So or sometimes a child's drainage angle, because this pressure in the eye builds up when the fluid that is being produced does not flow out effectively. So if something happens to this child's angle through which this fluid flows during the child's formative stages in the womb, that can also make the child to have congenital glaucoma.
So you talked about some babies being born with glaucoma. You talked about 40 years and above. Who is really at risk of developing this eye problem?
Okay, so the fact that we're Africans, especially...
This matter of the fact that we're Africans, I don't understand.
Especially the western part of Africa, Western Africa, yes, we are more at risk of having glaucoma. Also, if someone is diabetic or hypertensive, that also predisposes the person to glaucoma. like I said earlier, when someone takes some particular kind of medications for a long time, then also trauma to the eye can also increase the
trauma
pressure.
to the eye?
Yes, like a blow or something, like a heavy object hitting the eye. Someone engages in a fight and gets punched, that can also, cause glaucoma. Then for people who smoke a lot or drink a lot,
smoking,
that also can predispose them to glaucoma.
But can it be prevented?
Definitely, and that's the message that we have been preaching, because we always encourage people to come into the clinic to have their regular eye exams. Some people don't believe they should go to the eye clinic except there's something wrong with their eyes, So if it's caught at the early stages, then the person's vision can be prevented. Glaucoma is not curable, but it can be managed.
Okay.
So if the patient is being given an eye drop or any medication for the, reduction of the pressure of the eyes, it's for life. And some patients, maybe they don't really get that message. They visit a clinic, they give them the eye drops, and then they just go. They wouldn't return again, and then they just get lost to follow up. So yes, if it's caught early, it can be, the vision can be preserved. Once a child is born, that is the first time the child should have his or her first eye exams. The next would be like when the child is about 6 months of age, and then preschool before the child goes to school. After that, every 2 years. But from the age of 40, I'd recommend every year or every 2 years. But if someone is at risk, family history is also a predisposing factor. Maybe someone's mom or dad or grandparents have glaucoma. That person is already at risk, so I advise that the person goes for an annual eye examinations.
Every year?
Every year.
Okay. What are the treatment options for glaucoma?
Okay, there are different treatment options. The first is usually the use of eye drops to lower these eye pressures. Also, we can recommend oral medications, which is the ones they take by mouth. Then, if these eye drops or these oral medications don't reduce the eye pressures the way we want, we then recommend surgery. These days we have the laser surgeries that can help to open up those channels through which the fluid flows. So basically, eye drops, oral medications, and surgery.
They're expensive?
Very expensive. Very expensive. And actually, that is why some people get lost to follow up, because just assume someone's monthly salary is about 50,000 naira, and the person has to spend about 30,000 naira buying a bottle of glaucoma eye drops. That's not sustainable. So glaucoma treatment is actually expensive.
But have you seen cases where, like you said, people lost coming back for follow-up, they don't want to come back because of the cost and all of that? And have you ever seen where some of these patients kind of find alternative treatment elsewhere?
Okay, yes. First of all, when a patient comes to me and I diagnose a patient
you run
of having glaucoma, yes, of having glaucoma, I would educate you properly, because I have noticed that sometimes maybe communication is a problem here. We don't communicate properly, or maybe the patient doesn't listen properly. So I make sure I educate you. Right, that is number one. Two, I have also seen some patients who probably relocated from another state, and then they come in with vision loss or something. Then when I carry out my test and then I ask questions, I would find out that these patients actually have been diagnosed of glaucoma long ago, and maybe they just stopped taking their medications, and then they present to the clinic with vision loss. And at that point in time, I can't call back the vision that is already lost, but what we just do is to preserve the remaining vision. Also, I have seen people patronize these herbal vendors. I have seen some people online selling some teas. They will say that if you buy the tea and you take it, if you have cataract, it takes care of the cataract. If you have glaucoma, and then you go to the comment section, you see people actually commenting and ordering for this tea. So that wouldn't cure glaucoma. It actually doesn't cure glaucoma. I've also seen some cases where some patients went back to the village. They would tell you, oh, my grandmother said I should come to the village so we can, take herbal medications. and then they come back worse. Probably the eyes are gone, because when you begin to instill all these herbal things into the eyes, it can actually cost your sight.
I asked if you run a clinic because I wanted to know, given the population of Nigeria, how many times do you see, or how many patients have you diagnosed to have glaucoma?
Okay, this
What's the
year,
statistics like?
The statistics. Okay, research has shown that about 1.3 million Nigerian citizens are actually vision impaired from glaucoma. And this year alone, I have diagnosed at least 6 patients. Not that they came in to have their eyes screened for glaucoma, but one patient came in the other day, I think last week. He said he noticed he couldn't see clearly with one eye. And by the time we checked, that eye was like 90% gone. And when I questioned, I asked him if he had just noticed it. He said, no, he actually noticed it about 3 years ago, but his health insurance didn't cover glaucoma tests and treatments, so he didn't even bother. So I think the masses need to be educated. People need to be aware of glaucoma and the impact.
Is your association doing anything to ensure that the health insurance get this covered, since costs is usually a problem for many Nigerians?
Yes, we're actually on it, and we also encourage policymakers to do something about it. There are some people who, some pharmaceutical companies, they ship in their eye drops. It's to clear it, it's actually a lot of them. They spend a lot of money clearing these goods. And by the time they bring it in, that also increases the cost of the eye drops. So we're actually calling on the policymakers to do something about it. But the Nigerian Health Insurance Scheme and some health maintenance organizations actually have some certain coverage for glaucoma treatment. So they are working on it.
Okay.
Yeah.
So before I let you go, I just need you to talk to us, because apart from talking about glaucoma, we want to look at the eye care generally. What and what should we do? Are there food we are supposed to eat nutrition-wise? Does food, first of all, has anything to do with it?
To do with glaucoma?
Yes.
If you don't maintain a healthy diet, that can also predispose one to having glaucoma. So we should actually eat lots of leafy greens and carrots. But there's this myth that carrots actually treats eye problems. That's a myth. The fact is that the carrots has some nutrients that are good for the health of the eyes.
Okay.
Right? So when we take some carrots, some broccoli, cauliflower, they have some nutrients that are good for the eyes. But how many of it can you take in a day? So there are some supplements actually that you can take to keep the eyes healthy.
You know, children who want to stay glued to their tablets, those who want to stay glued to the television set, we workers who want to stay glued to our computers. So just generally, how we take care of the eyes?
Okay, first of all, regular eye examination is very, very important. Last week, as an association, I want to just tell a little story.
Okay.
We went to one of the markets in the FCT because we wanted to reach the grassroots. We wanted to just educate them. And then when I was talking to a particular guy, he sells some things, and he told me that he can't just walk into the clinic to have his eyes checked because he has bills to pay, he has school fees to pay, the government is not taking care of them, he has, house rent to pay and all of that. So I had to convince this guy, and I had to educate him on the importance of regular eye examinations. And luckily, last week, some clinics were running free glaucoma checkups. I invited him to the clinic for him to have his eyes checked up. So now, regular eye examination is important, and it's not even that expensive. That is one, because early detection is very crucial. Then two, for children, you mentioned children. These days they're always on the tablets. I think I would advise parents to make sure that they get enough time outdoors.
Okay.
So that they kind of exercise their eyes, look at something far away, because when they consistently stay glued to the screen, it can cause myopia, which is short-sightedness, because these days there's increase in the number of patients, the number of children who come down with myopia. Also, I would advise for adults who always work on the systems to observe what we call the 20-20-20 rule, which is for every 20 minutes, you take 20 seconds to look at something 20 feet away from you. That kind of exercises the muscles of the eyes. You're not just staring at your screen, you're looking at far and then you're coming back to look at your screen. Try to blink regularly if you're working on your screen so that you don't develop dry eyes. Because these days we have a lot of dry eyes cases. Exercise regularly because exercise is very important to the well-being of the eyes.
How?
Because when we exercise, the blood flows.
Okay.
Right? Yeah. So, also, food. If you eat healthy, that also helps your eyes to stay healthy. Like I said, if you can't get all the supplements in the regular food we eat, in the natural foods we eat every day, you buy some supplements that are rich in lutein, zeaxanthin, vitamin A, C, E. So those are the things that we can do to make sure our eyes stay healthy.
All right, thank you so much. I have been speaking with Dr. Obiageli Oketa. She is the co-chair, Public Health Committee of the Nigerian Optometrists Association. Is this FCT or?
FCT.
FCT, okay, FCT chapter. Thank you so much for your time.
Thank you so much.
All right, that's all we have for you today on this episode of Health Digest. Remember, your health is your wealth. Stay safe. I'm Ogom Ezedimbo. Take care of your eyes.